Thank you, everyone who's joined us. This is a record number of people who have joined our series of informational meetings. It's meant to educate everyone who's on the call about vaccinations and the importance of vaccinations, but for very specific issues or concerns. And so today we invited Dr. Menjean Lee, who is a Kosasa Endowed Professor at the John A. Burns School of Medicine here at the University of Hawaii. She's also well known for being a national leader in both the research and teaching and clinical delivery of maternal and fetal medicine. And by no chance is director of our division of maternal and fetal medicine at Kapiolani Medical Center. Tracy Sandher, our senior manager for population health and disease management, will be moderating the program, but it's my pleasure to introduce Dr. Menjean Lee and Tracy.
Okay. Well, thank you so much for such a generous introduction, Dr. Okamoto. I'm really pleased to have this opportunity to talk to all of you about the COVID-19 vaccine. And I do have to beg forgiveness. I've been on call overnight taking care of our COVID unit at Kapiolani and have been up since midnight. So I'm gonna do my best to try to keep this exciting for you. Okay, and then I don't have any particular financial interests or disclosures, just the maternal fetal medicine doctor trying to help take care of the women in Hawaii. So today we're just gonna go over some basic COVID-19 infection issues in pregnancy, particularly here in Hawaii, review some of the available information about the COVID-19 vaccines, and respond to some common questions that I've been getting from patients, and then talk about and discuss some talking points for pregnant patients so that we can have some shared decision making. All right, so as you can see, I downloaded this data from yesterday that around the world, we're kind of reaching our fourth wave of COVID at this point. And the Americas, this is from the WHO website, we're still at the highest number of COVID infected patients in the world. Overall, over 200 million patients have been infected, and there's been over 4 million deaths now around the world. And then the WHO also has reported vaccination rates globally. And as you can see, a lot of other countries are doing way better than we are in COVID vaccination. They've kind of reached that herd immunity of over 70%, whereas in the US, we're right in the middle of the pack, sitting at around 60% herd immunity, but full vaccination is still at 50%. So we're not doing so good. We have way too many vaccines and not enough people with arms to take the vaccine. And so bringing it closer to home here in Hawaii, our first vaccination occurred on December 16th, 2020. And you see after the vaccine, our rates did go down, but then over the summer, people got kind of lax, and then now it's peaking again. And so this is why you can hear some of the urgency in my voice as we're talking about it, because I am a frontline worker and we are seeing these patients come in now. And so to give you an idea about our ICU bed utilization, if you look at the 3 main hospitals that take care of adults, so that would be Kapiolani, Straub, and Queens Medical Center. Our ICU bed status is now peaking, and we're running out of ICU beds. But this does not include information about Kaiser because they have their own system, and also Tripler that has their own system. And these are, the statistic is pretty alarming. And we're also running out of ventilators. We haven't yet switched over to using ventilators from the operating room. So all of the OR machines can be switched over to ventilators, and we're prepared to have to do that if we run out of ventilators, but we're getting close to being in a dire situation. And so here in Hawaii, our vaccination status, we have approximately 61% of our patient population fully vaccinated, and a little bit more that have at least gotten 1 shot. And so Honolulu and Hawaii are kind of leading the pack in getting the patients vaccinated. So specific to pregnant women, there's been a lot of misinformation out there and a lot of reluctance to vaccinate pregnant women. We started out in January 2021 when the WHO had issued a statement to kind of hold off on vaccinating pregnant women. However, this was quickly changed in February of 2021, where the CDC, ACOG, and the Society for Maternal Fetal Medicine issued a statement to start offering vaccinations to pregnant women. And especially for those pregnant women that were first-line healthcare workers or immunosuppressed, or some that were considered elderly. However, that's changed now. So as of July 30th, 2021, during this the fourth COVID surge, the American College of OBGYN and the Society for Maternal Fetal Medicine are now strongly recommending vaccination during pregnancy for the COVID infection. According to the CDC, only 22% of pregnant women have received any vaccines during pregnancy. And we are currently seeing, both here in Hawaii, which matches the mainland, that 95% of persons requiring hospitalization for breathing and respiratory services are not vaccinated. And so just recently, last week, the CDC finally came out with a recommendation that pregnant women need to take, or highly encouraged to take, the COVID vaccine for both pregnancy and also if they're going to be breastfeeding. So why is it so important to vaccinate our pregnant women? So they are at 3 times higher risk for being hospitalized in an intensive care unit and requiring a higher level of support, which means putting them on a ventilator and putting a tube down their throat to breathe for them to keep them and the babies alive. They are also at higher risk for needing ECMO, which is a heart-lung bypass machine. We currently have women that are waiting to get on those machines right now, and they are at almost twice higher risk for death while they're pregnant and infected with the COVID-19 virus. When you get COVID, you're at a possible increased risk for premature birth, because sometimes we need to get the baby out before the mom dies in order to save her life. So this is important for those with severe illnesses, and this is what we are seeing right now on the ground. There are no birth effects associated with COVID-19, which is kind of different than the Zika virus that we had a couple of years ago. And vertical transmission, meaning mother to baby transmission of COVID during pregnancy, is extremely rare. And so there have been 3 COVID-19 vaccines that have been that have had emergency use authorization from the FDA. And so all of these vaccines work in the same way, that they give instructions to the patient, the woman or the mother's body, for their immune system to make antibodies that block the virus that causes COVID-19 infection. And so the ones that you've heard about in the news are the 2-dose Pfizer mRNA vaccine, the 2-dose Moderna mRNA vaccine, and the 1-dose Johnson & Johnson vaccine, which uses a adenovirus vector. And I'm going to go into that in a little bit more detail so that you can share this with your clients. So which vaccine is better? So I get this question from patients, and for what we're trying to tell everybody is whatever one you can get your hands on, okay? Oxford AstraZeneca vaccine, which is very similar to the Johnson & Johnson vaccine, is probably the cheapest one. And it requires standard refrigeration, and it's a 1-shot of vaccine. So this one and this one are kind of the same, but we don't have the AstraZeneca one. This is the one that's in Great Britain, so we've been using this one. However, the 2 other popular vaccines that we have here in the US are the Moderna one and the Pfizer one. And those are, from an insurance point of view, everything is free to the patient, so let them know that they don't have to worry about it, but it's covered by insurance, and they're about $20 to $30 per vaccine with excellent effectiveness net rates, okay? The Moderna vaccine needs to be given basically about 4 weeks apart, and the Pfizer vaccine is 3 weeks apart. And the reason these vaccines are hard to get is they require special refrigeration, and I'm going to explain why. Okay, another question I get from a lot of patients that seem to be just finding a lot of excuses for not taking the vaccine is like, were the vaccines made too quickly? So normal traditional vaccines usually take years to make. And so that's why, like, 10 years or more to make, but this one we got out in about 2 years. And there's a reason for that. mRNA vaccines are a little bit different compared to the traditional vaccines, but they were not really made too quickly because of these other reasons. So the technology for mRNA vaccines have been studied since the 1990s. So they've actually been around for almost 20 years, but it just hasn't come to light until now for this public health emergency. When we were using mRNA vaccines for treatment of cancers and other diseases, they have not been found to affect fertility or cause any problems with pregnancy in animal studies. So there's been a lot of research in them that took place. They don't contain any virus particles, so you don't have to worry about getting infected from the vaccine. And the other fun fact is the mRNA is very unstable. And that's why they have to be deep frozen, and they're so hard to administer because we have to keep them in a deep freezer, because mRNA, which is the signal for making an antibody that's going to be against the, these famous virus particles, they're eliminated. So the vaccine, the mRNA vaccine, is eliminated by our bodies really, really quickly by an enzyme called RNase. And so when you get the vaccine, it's really unlikely to get across the placenta because the placenta is filled with a lot of RNase enzymes. And so I can tell you from being a research scientist as well, that I have a lab over at UH Manoa that we have the darndest, hardest time trying to get RNA out of a placenta, human placenta, because the placenta just chews it up. So it's its own way of like protecting the baby. And so that's why the RNA vaccine needs to be deep frozen and also protected by a lipid coating so that your body doesn't chew it up. And so we get, our patients saying, oh, I don't want to use any new vaccines or medicines. It's all too new. Well, in reality, when the patients come in really sick from different things, we use new medications all the time, especially in the case of emergency. So, the stuff that you heard about, remdesivir or Regeneron infusions that are being used to treat people with COVID infections are just as new as the vaccines. And so they are under emergency use authorization here. This is the remdesivir injection. And so if the person, whether or not you're pregnant or not, and you come in sick and you're having trouble breathing, do we not give you this remdesivir because you're like, oh, it's too new? Or do you want us to try to save your life and give it? Okay, so kind of use that logic and think, if the vaccine is new, so are these other fancy medications. So you might as well take the vaccine so you don't get COVID, so that we don't have to give you another new medicine. Okay, and so now more pregnant women have received the vaccine than the actual new anti-COVID medications that are out there. Okay, so another question that's coming up. Are the COVID-19 vaccines safe to use during pregnancy? And the answer is yes. Okay, because the mRNA vaccines prior to January haven't been used in pregnancy, and other vaccines that pregnant women take all the time and all your babies get all the time are different formulations of vaccines that are using inactivated viruses, attenuated viruses, or they're using like recombinant DNA type things, which is different than the mRNA. So yes, we agree that this is new for pregnant women. And when they were doing these big trials, vaccine trials that were happening last year, they didn't include pregnant women. And so that's why this is considered new. But some of the trial participants accidentally became pregnant. And so now we know that all of these women that were pregnant during those clinical trials of the vaccines, all their babies turned out fine. And so now they're doing secondary vaccine trials of volunteers who are pregnant and trying to get us more information. But we have a lot of good data now to share. So are the vaccines safe to use in pregnancy? Yeah, over 135,000 women have taken the vaccine while they've been pregnant. And there's been no effect on fertility. People are getting pregnant pretty easily still. We're seeing the pregnant ladies, okay? So it's not making them infertile. The pregnant healthcare workers were first in line to get these vaccines. And I can tell you here in Hawaii, some of my OBGYN docs who see a lot of patients, they were first in line to try to get the vaccine. And they've had their babies and all their babies are perfectly fine. And so they're proud to say that the vaccine is safe. And if it's good enough for them, it should be good enough for their patients. And then there is a vaccine registry known as the Vaccine Safety Data Link that's being used across the country right now to just track to see if there's any other funny findings that have come out. And so far, everything is coming out A-OK. So the question is, okay, is the mRNA vaccine going to cause miscarriage? Will the vaccine hurt my baby? And the answer is no. So there was a really wonderful study that came out in June of the New England Journal of Medicine this summer that showed that the miscarriage rates in women that got the vaccine were better or not the same as those miscarriage rates of women who didn't get a vaccine, but this was prior to the COVID pandemic. We also found in that article that stillbirth was also the same in both groups. Prematurity was also the same in both groups. Okay, and babies with birth defects was same in both groups. So we know that the vaccine is not causing birth defects. And especially since I told you the vaccine itself can't cross the placenta. And then another really great piece of data to share with your patients and clients is that the COVID-19 vaccines causes the mom to make antibodies, right? And the antibodies, just like with any other vaccine, is what protects mom and baby. We found evidence of the antibodies in the placenta and in the breast milk at much higher levels than in this yellow box down here, where patients are just getting antibodies from natural occurring COVID. So the vaccines help you to make more antibodies to cross the placenta to protect your baby and to cross the breast milk to protect your baby once it's born. So this is all really exciting news to get out to the public to say, hey, breastfeeding will help to protect your baby as long as you take that vaccine ahead of time. So what really happens after the mRNA vaccine is injected? So this is just a cartoon of like somebody's muscle where if the lady got a COVID vaccine. And so what happens is once the vaccine gets into your body, it's using the cell's own machinery, which is called a ribosome, that makes fake viral proteins, you know, those famous spike proteins that will train your cells to make antibodies against it. And the fake viral proteins will also go to your killer T cells and trains them to like kill the virus directly. So it does it in two different ways. Now, I get this question at the beginning of the pandemic, when we were launching all the vaccines. Is the vaccine going to turn me into a zombie? Because, you know, it's this mRNA stuff. And the answer is no, because the mRNA vaccine itself can't get into the DNA where your genetic code is being developed. It can only stay outside in the cell cytoplasm, where the machinery then makes that spike protein that causes your immune cells to get activated. So this is all really good news. You're not going to turn into a zombie, because all of us would be walking around as zombies right now. And we're not. Okay, I've also heard rumors that people are telling our pregnant ladies the vaccine can cause tears in the placenta and you can miscarry. Well, this is not true, all right? COVID infections can cause damage to the placenta, but not the vaccine itself. And so this is research from Northwestern, some of my colleagues from back in Chicago, where it shows a damaged placenta from a woman with COVID infection. Okay, you can see lots of blood clots everywhere and lots of scar tissue compared to a lady who got the COVID vaccine. Her placenta is nice and normal. You don't see those big blood clots. You don't see the scar tissue, nice, normal, healthy cells. So that's also good information to let your patients know that COVID infections cause damage, but the vaccine doesn't. Okay. Is the mRNA vaccine made from microchips? Are we injecting microchips? Or are the vaccines being made in cells from dead babies? All right, the answer is no. Once again, that mRNA vaccine, remember, it's really, really unstable because your body chews it up. And so it's actually machine made, and we have to wrap it up in a lipid bilayer to prevent your body from eating it up too prematurely. And so the vaccine itself is made of the mRNA with a lipid bilayer with some salt and sugar floating around in there to kind of keep it nice and moist, so that once it gets into the body, okay, the vaccine then releases the mRNA out to the cell machinery to make the fake spike proteins that the body then uses to make the antibodies, okay? And any free-floating vaccine out there this is a little Pac-Man cartoon, will get chewed up by your body. So, so this is how it works. So no microchips, and there's no dead babies doing this. It's all kind of like synthesized, made by a machine. Okay, another question that keeps popping up. What's going on with the J&J AstraZeneca vaccine? And so everybody's worried about these mysterious blood clots. But if you look at the numbers, the actual blood clots with the J&J vaccine is very, very low compared to like taking birth control pills, a little bit higher blood clot rate, okay? So, and then if you catch COVID, your rate of getting blood clots in the ICU patients is pretty high, 20 to 30% compared to like the vaccine itself. The blood clot rate is 0.000088%. So when the patient, a particular pregnant lady that comes into the hospital that's really sick from COVID infection, from this, we're giving them blood thinners just so that they don't clot, okay? And so why are they blood clotting? What we don't know for sure, but what we think is that the vaccine is causing the body to make antibodies that are against the spike protein, but it also is too close and very similar to some of the antigens, or what the platelets or the blood clotting mechanisms are very similar. And so maybe it's causing those platelets to stick and then causing a blood clot. Okay, vaccine side effects. This is what I heard from one of our ladies this morning, like, oh, you know, what if it gives me like a flu kind of symptoms? Okay, if you've taken the flu vaccine in in pregnancy, or with your annual flu vaccine, we all know you might feel a little junk the next day, and that's normal. That's okay. It means that your body is trying to make those antibodies. And so we know that with one of the side effects of taking the vaccine is a fever a day or two after vaccination. And it happens in, a little bit in the first dose of the vaccine. And then after the second dose, maybe 15% might get a little bit fever the day after. And that side effect rate is a little bit lower with the J&J vaccine. But this flu-like symptoms, you can take Tylenol, which is totally safe during pregnancy. So the vaccine side effects are very similar to your annual flu vaccine. So most of the time, like, we're telling everybody, don't worry about the side effects, because it's kind of like taking your annual flu vaccine. Okay, the big one now. Why are mutations developing? What's going on with this Delta virus and all these other viruses, the other Delta variants and these other variants? So variants is just another fancy name for mutation. What's happening is those spike proteins are mutating now because every time the virus affects another person, it has a chance to mutate. And that's why when viruses reproduce, they're going to mutate, and that's why we get a yearly flu vaccine. So this is the same thing that's happening with the COVID virus. Is like as more and more people keep getting infected, it's giving the virus a chance to mutate. And so we have like the Alpha variant, which came from England, and then the Delta variant, which came from India. And now people are starting to worry about the Peruvian variant, which is the Lambda variant, which hasn't hit us just yet. But we're worried about this Delta variant right now, which is spreading like wildfire. So the last check, the Hawaii Department of Health is tracking our variants. And so whereas like in June, the Delta variant is in kind of green, in orange. And now we're in August. Look, we went from like 1% to like 10% to now like 80% or more. The Delta variant is in our community, and we know that the Delta variant in orange is the bad guy because it transmits really easily. It can transmit even if you've been vaccinated, and it's making people really sick, including our pregnant ladies. Pregnant ladies are getting hit particularly hard right now. And so if you look at, the cartoon that you've been seeing on the news about the COVID virus having all these spike proteins, the antibodies attack these little spike proteins. And so that's how you kind of neutralize the virus. However, if there's enough mutations on this, where the antibodies might not work anymore, we have to try to develop other vaccines that can cover the mutation. Right now, there's enough cross-reactivity with the current COVID vaccines that we have, like the Moderna or Pfizer, that there's still some protection. But if we let this pandemic go on for too long, we're going to end up very similar to like the flu vaccines, where every year we have to make a new one based on the mutations that are out there. Okay, so what's happening to the COVID infected pregnant ladies here in Hawaii? So more and more are getting infected, they're getting sick, they're having to come to the hospital to get oxygen support compared to what happened last year. Last year, I would get a pregnant lady like once every other week, which was easily, managed. However, this time around, I'm getting like 7 to 10 a week. And we're running out of ICU beds. We're running out of oxygen supplies, running out of the doctors and nurses because everybody is now tired, okay? And what we're seeing is the COVID infection is causing inflammation of the mom's lungs so that they can't breathe, and it's doing something to their heart where it's stopping their heartbeat. Okay, not a good thing when you're trying to carry a baby and keep a baby alive. And we've had to do some emergency C-sections now to get that baby out, but it means that the baby's either preemie, and risks not being able to make it because it's too preemie, okay? And so all of the pregnant women that have been admitted to the hospitals right now have been unvaccinated. And so I don't want to sound desperate or alarmist, but we really need your help to tell all of your pregnant ladies and all the clients, friends and family, go out and get the vaccine right now because we're running out of stuff that we can do to try to help, keep everybody safe. So what are options for the pregnant patient? Well, you can try to get them vaccinated before trying to get pregnant. So that's one way. But once you're pregnant, it's kind of like you can't do it before you get vaccinated. We can tell patients to if you're worried about miscarriage, wait till second trimester when your natural risk of miscarriage is lower. But it might be too late because you might catch COVID before then. Or just get the vaccine anytime during the pregnancy so that you can start making those antibodies to help protect your baby. Some women are wanting to wait till after birth to get the vaccine, but by then it might be too late because then you're not able to get the antibodies in your breast milk so that you can protect your baby. If you're going to wait till after birth, you're going to need to isolate during pregnancy. And we already know that women who are single moms living alone have less COVID infection than those that have a partner or family members, because the partners are bringing the infection home to them. I mean, you can't help it, and they're not doing it on purpose. But if they're carrying it and they infect the pregnant lady who's, their spouse or other loved one, that's a problem, right? And so we still need to keep our masks on. You got to do good hand hygiene, all right? And better yet, be able to quarantine in your house. And not everybody in multi-generational houses is going to be able to quarantine. You can't just lock up the pregnant lady, in a room somewhere. She's still going to need to go to the kitchen or go to the bathroom. So this, physical distancing, is very, very tough to do realistically. So other things that we need to bring up is that the CDC recommends taking a COVID vaccine at least 14 days before or 14 days after any other vaccination. Because during pregnancy, we're already giving people flu shots and the Tdap vaccine to prevent whooping cough. So there's still other things that are that pregnant women can get sick from. So we want to try to get all these vaccines in as much as we can. And then if a patient contracts COVID infection, we do recommend that they wait 3 months until they get better, and then they should still take the vaccine. Because remember that other slide I showed you, that the vaccine gives you more antibodies than catching COVID by itself. So you need to take that extra vaccination. Other key thing to remember is breastfeeding is still best so that you can transmit all those good antibodies to help protect your baby, whether or not it's the COVID vaccine or something else. And so just keep in mind, the vaccines help you make more antibodies. So to summarize, the Delta variant is spreading like crazy here in Hawaii, and pregnant women have been left unprotected. And so we're strongly encouraging pregnant women to take the vaccination so that it just makes sense to make antibodies so that they can protect the baby before and after birth, because the babies are born with no protection otherwise. And then just keep in your mind, the mRNA vaccines themselves don't cross the placenta, so they can't do anything to the baby. You need the antibodies to protect the baby. And so we really urge our healthcare providers and also friends and family members to get the message out, to get everybody to go get the vaccine. And if it's not for yourself, do it for your baby. And so this was an important quote that was in the New York Times from the University of Pennsylvania. If more people can get protected right away, the virus is going to have fewer hosts to infect and less opportunity to evolve into the new variants and these new mutations. And so final word is just protect yourself and your baby and go out and get vaccinated. There's clinics all over the islands now that have patients to sign up for their vaccines. And then some of the places are also doing walk-ins. So that if you want to just get a walk-in clinic and just show up, there's lots of places that are starting to pick that up, including some of the federally qualified health centers are saying, oh yeah, we can do walk-ins. We also have that Aloha Care van that's going out that can do vaccines. And so I just wanted to say thank you to the Aloha Care team for trying to give us an opportunity to share this information, and also getting that Aloha Care van out there and trying to get this information for all of the pregnant ladies in our state so that they can get vaccinated. Thank you so much, and I'm happy to entertain any questions.
Oh, thank you so much, Dr. Lee. Can you hear me okay?
Yep.
Okay, yeah, this is such great information, especially that slide on the antibodies and that high count on the vaccinated versus Contracting. Yeah,
Yeah, I mean,
that's kind of
was
mind blowing.
Yeah, I just, when I saw this, I'm like, oh my gosh, over here,
Yeah.
more antibodies compared to down here. It's like, get the don't just go out and catch COVID. You might die from catching COVID. You won't die from getting the vaccine.
Right. Yeah. Wow. This is excellent. Yeah, we can definitely take this information and share it with our membership. It's so helpful. Thank you so much. So at this time, we're going to take any questions. So if you have any questions, we had a few prepared, and I think you answered almost all of them through your presentation. But if anyone has something more specific, you can go ahead and enter that in the Q&A section of the webinar. Just going through a few now. So I have one that's not full. I don't think you answered this. So if I become fully vaccinated long before getting pregnant, will I still pass on the antibodies to my baby when I breastfeed, or does it depend on how long ago I received it? When would you recommend a third vaccination?
Okay, that's a really hot question right now, right? Mm-hmm. And I think the President Biden's administration made some kind of announcement today that they're recommending a booster approximately 8 months after the initial vaccine series. And so that, the trick is to kind of keep vaccinating and keep using the epidemiological tracking that the Department of Health is doing, so that if new vaccine formulations need to come up to help cover the different mutations that are developing, that's going to be probably the best way to go. Now, one of the controversies as we talk about social justice is that the WHO last month came out with a recommendation for the first world nations, which is us, not to do the boosters until all of the other poorer countries get their initial vaccines. And so that does make this a little bit troubling and very awkward as a first world nation, that we've been storing away all of these vaccine doses, but we can't get enough people to come out and get them. And so they're getting wasted instead of being sent over to, poorer nations in the Africas and South Americas and Asian countries that need it more. And so this is kind of sad that we're hanging on to this stuff. And meanwhile, the WHO is like begging for help to get the vaccines out to them for their first shots. And meanwhile, we're already talking about getting the boosters. So, but that is something to think about, that, if you get your vaccine now and you're not pregnant, that's a good thing. Keep doing it, because we don't want, if we can get it to stop in its tracks to prevent it from mutating, then you'll be ready to get the booster the next time around. Does that make sense?
Yeah, definitely. We have a follow-up question to that, actually. Is that 8-month booster timeline based on any study of antibody count in vaccinated subjects?
Yeah, apparently. I mean, I haven't seen the actual journal articles come out, because it just came out in a press briefing. But I know that between Moderna and Pfizer, they have been studying the booster, the idea of the boosters, like how often you have to give it, or how long you have to wait before you give it, and can you switch vaccines? Can you switch from one booster to a different kind? So I can't answer that question right now until the actual medical papers come out, but I know that they've been studying it. And I can also share with you one of my good friends who is in Florida. Like, she signed up for to be one of the trial members for the Pfizer vaccine. And so when they were recruiting for the booster trials, she signed up right away to do the booster trial, because she wants to be able to help, get that information for everybody.
Okay, we have a couple more follow-up questions to that. Because the mRNA is very unstable, is that why a booster vaccine is being recommended?
No, the booster vaccine is being recommended because the mutation rate. And so if the antibody, if the virus, the antigen, so the virus is mutating too much, we might need a modified booster to make sure we cover new forms, new variants. And also your body over time, some of your antibodies may go down over time. And so you need a booster to kind of get your immune system to get revved up again, to attack whatever new variants or even the old variants. So over time, boosters help to keep our immune system primed to continue to like attacking all the viruses.
Okay. Yes, that makes sense. So, one of our staff is 23 weeks pregnant and fully vaccinated. What are your thoughts on the new booster? Is it recommended to get the booster prior to giving birth?
If you fall in that 8-month window, and then go ahead and do it. If it's still too soon and you're still like, in a 3-month window, then no need.
Okay.
And then, I got a question before from another patient. I didn't put it in the slide, like how soon after the first injection do you start making antibodies? And it's about 2 weeks. You start with the first shot making a little bit of the antibodies, and then the second shot, you get a big boost. But you do start making it within 2 weeks of the first injection.
Okay. And I think you covered this earlier about what's the safest vaccine for pregnant women. It sounded like it's more of an access and maybe cost issue, but did you want to touch on that again a little bit?
Sure. Okay, it's not a cost issue. All vaccines are totally free right now because the U.S. government has paid for all these vaccines, and it's all free. And so a patient should never feel like, oh, I don't want a vaccine because I can't pay for it. Okay, this is a public health emergency. Now, I showed you some of the information about the Johnson & Johnson vaccine, that it does, there is a slight association with the blood clots. And it's an easier vaccine to take because it's only one shot. Okay. However, we know as maternal fetal medicine specialists that pregnancy hormones themselves help to like make you clot more, because biologically we don't want pregnant ladies bleeding to death. So our concern is like if you do a J&J vaccine, which increases your risk of clotting more, and being pregnant increases your risk of clotting more, maybe better not to chance it and then kind of deal with taking the 2 shots instead of the 1 shot. We don't really have good data to say that the other 2 are better, but just kind of intellectually, I know it's 2 jabs instead of 1, but maybe the other ones might be a little bit better, but this is just, personal guessing.
Sure. There's some concern around getting a fever from that second dose before that neural tube closes at that 15-week mark. What's your experience and recommendations for the timing around receiving the vaccination?
Good question. Yes, that's a really great question. All right, so sustained fever can be associated with neural tube defects. We have not seen an increased risk. We're not seeing hardly any neural tube defects coming through this past year. So, so we're not seeing it in reality. And then with respect to prevention of neural tube defects, most people are already taking folic acid in your prenatal vitamins to help prevent neural tube defects. So that must be doing the trick, and taking Tylenol so that if you do have a fever, I did have some patients like, oh, is Tylenol safe? And I can tell you it is one of the safest drugs to use during pregnancy. We give out Tylenol like candy for any other things, toothaches, back aches. And so if you're worried about getting a fever, go ahead and take the Tylenol, before your second shot. And just like we get a majority of all of the ultrasounds that are being done across the state And so far, we're not seeing any increase in neural tube defects.
Oh, great. That's great. Yeah. So, I mean, we have a set of questions that we can go through.
Sure.
But most of these, I think you kind of touched on, but you could, elaborate more if you think.
Sure.
Okay. So, will vaccines cause permanent genetic mutations that the child will bear and pass on?
Okay. Yeah. So I did cover that in that particular slide.
Mm-hmm.
Is that, let's see if I can get to that one. Okay. So this is like a cartoon of a cell. Okay. And the cell has a nucleus where it contains your genetic material. So the vaccine or the mRNA comes in through here. It never has a chance to get in here because there's no material, no machines to bring that mRNA inside. Only DNA can be contained in your nucleus. Okay, so no mutations, no mutant Ninja Turtles, and the idea that that the vaccine mRNA is going to even cross that placenta barrier, it's going to be almost nil. So no action on the baby. The only way to protect your baby is to get these antibodies to cross the placenta to help protect your baby. So the vaccine itself is not going to really do anything to the baby. And that's why when we have our pediatricians come talk to you, that like babies are too small to get the vaccine just yet. So so we're there, maybe a vaccine could be developed for babies in the future, but right now we're totally reliant on the moms to make the antibodies to come across. And the antibodies do not cause mutations, okay? The antibodies are the same like any other vaccine that we take, like, hepatitis B vaccine. If the mom is protected and she's got the antibodies, those antibodies come across to protect the baby from getting hepatitis B. So we use the same thing for all of these other strange viruses that can get people infected during pregnancy.
So are there any specific cases in which you wouldn't recommend a woman receiving the vaccination during pregnancy?
No, unless we are actively in the hospital with COVID infection, we wouldn't give it to them until they're 3 months out. So, but otherwise,
good to know. Yeah,
everybody should just get it.
Just get it. Yeah. Is there any evidence at this time showing differences with how different variants of the virus present in pregnant women? Are you seeing a difference in? I think you kind of mentioned with the Delta, hitting the women, the pregnant women heavy.
Yeah. We don't know for sure. And based on the women that we've seen more recently, and remember, we're talking handfuls right now, so we don't have a big study, unless more people on the mainland start reporting it, is that this effect on the heart, we didn't see this last year. So the Delta making it more toxic to the heart, it's too premature to know, but it is definitely something we're keeping an eye on right now and we have all our patients on heart monitors and telemetry at this point, because maybe this might be something that's different than the other variants. So for this particular picture, you see this lavender variant, that's the California variant. And so this was what was going on last year. We had a lot of the California variant, and from the pregnant point of view, we didn't really see any of the maternal heart issues compared to now with the orange variant, which is the Delta variant.
Okay.
Too soon to tell. One other thing about the Delta variant, just to let people know, there was one paper that came out that the Delta variant is more infectious than the other variants, almost like 1,000 times infectious. So they've done some studies where you swab the nose and then you can count how many viruses are in there. So the carrier rate for the Delta seems to be like 1,000 times than the California variant.
So I think most of these questions you've pretty much answered in your presentation. But you know, there's always still come across some resistance. Do you have any general thoughts and recommendations on how to discuss vaccination with friends, close friends and family that are still resistant?
Yeah, I know. But the first thing is to try to hear them out and find out why they're scared, or what the issue is. You know, so I was working on Maui the other day, and one of my patients said, "Oh, well, my uncle got vaccinated and then he died." And I said, "Well, when did he die? From COVID?" "Well, he died like a week later." I said, "Well, he didn't have enough time to build the antibodies." And so she's like, "Well, that's why I don't want it." I'm like, "Well, however, hearing that, you know, most pregnant ladies that have COVID are being transferred to Honolulu right now because we only have high-risk pregnancy doctors here on Oahu. So we're getting most of the pregnant ladies coming here, and seeing what's happened to them so far is important information to share with friends and family members. Some of the patients now that we've taken care of have volunteered to like speak on TV. You know, I don't know if anybody saw the lady from Kahuku who voluntarily spoke up, you know, in the evening news that COVID was real. It's not something to mess with. She almost lost her baby, and was one of, you know, the ones that we had to do an emergency C-section to get the baby out before she died and her baby died. And, you know, which makes all of us cry, because it's just like to see a young woman who happens to be not vaccinated, but her get sick to that point where the doctors have like run out of stuff that we could do. It's a lesson that we need to share with everybody else. Like, we don't want this to be you. And so getting that information out, getting the information that I've shared with all of you in this talk, that if you're saying that, oh, well, the vaccine's too new, it's too new. If you're coming in and with really bad COVID infection, and we have to give you one of these other medications, like the Regeneron or the Remdesivir, are you going to tell me, oh, that's too new, I don't want that? Well, then what am I going to do for you then, right? So you can't use that as an argument. That, and what if we run out of those medicines and we can't get it for you? Then what? So why not do some prevention and protect yourself at the beginning, and also share that information that it makes sense with all of the other public health information that we give out to moms, like breastfeeding is best, right? That's how you can protect your baby. And it works the same with COVID. Make those COVID antibodies so that you can protect your baby while it's still inside, and breastfeed afterwards, and use that as a way to protect your baby once it's born. I think that part of the information is really powerful. That if you're not going to do it for yourself, do it for your baby.
Right. Yeah.
Dr. Lee?
Hey, well, we're coming at that. Yeah.
Hi, Gary. Yeah, we're coming to that hour. I think we can probably go on for another hour at least. I want to thank you so much. I also want to thank the participation of all those who have taken time to join us today to hear Dr. Lee's excellent presentation. And thank you, Tracy, very much for your moderation. I want everyone to know that tomorrow the pediatric colleague of Dr. Lee, Dr. Natasha Ching, who's a professor also in the John A. Burns School of Medicine, Department of Pediatrics, and an expert on infectious diseases, will be also a featured presenter at our next informational meeting tomorrow.
Yeah. And,
Thank
and
you.
Dr.
Yeah.
Ching is amazing because we work together a lot on infectious disease and pregnancy. So we've been trying to work on the congenital syphilis project. We're trying to look at toxoplasmosis, but then COVID right now is affecting so many more people, so that we had to jump to this pretty quickly. And so her talk is bound to be excellent because we usually give our talks together. So I'm so glad you got her to come speak with you tomorrow.
Yeah, very good. And she'll give some updates on the vaccination issue and how close you can actually have a couple vaccinations. But I want to bring this to an unfortunate end, Dr. Lee.
Okay.
And wish everyone the best. And thank you for joining us.
And thank you for all your questions. All right. Have a great day.
Thank you. Have a great day. Thank you.
Bye-bye now.
Thank you.